So I am going to be changing a PICC line dressing, and we're going to go ahead and start on my mannequin arm here, which already has a dressing on it and everything. So we're just going to be changing this. And I've already set up my waste receptacle down here on the floor and everything. I have already washed my hands, introduced myself to the patient. I have my supplies, and I've explained the procedure to the patient at this point in time. So we are going to don some gloves to take off the equipment that is here now. And we want to be careful not to pull on this catheter whatsoever. So I'm holding that in place with my thumb and fingers, just trying to get this dressing loose. So what we would do is just pull in toward the IV sight line and take all of this off. You could use alcohol pads to help loosen this up. I'm just going to hold this BioPad in place that's here as I pull everything, and you'll actually notice that this arm actually has kind of like a stat lock, so it can't be pulled out, which is great, but doesn't mean I can pull harder on any of this, because you could also be causing discomfort for the patient. And I don't want to touch around the IV site too much, because I'm trying to lower the risk of infection to this site. And this looks like it's been on for a while. So this just had a BioPad to it and everything else, and we're just gonna go ahead and trash that. And I'm gonna feel around the IV site, but not getting too close to the site, and ask for any pain or tenderness upon palpating and everything. And patient has stated no, so at this time what we're going to do is clean it up and everything with alcohol pads. And there is a stick in here. I forgot the name of it. It's kind of like a chlorhexidine, if I'm not mistaken. So we're going to use that applicator and everything else. So at this point, I'm going to take off these dirty gloves from taking that dressing off and everything else, and I'm going to throw those away. And now I'm going to open up my sterile kit that I have here. And this procedure is done as a sterile procedure. So before I move further, I'm going to don a mask as well, because I don't want to be breathing my germs on this. And I should have actually put the mask on probably at the beginning of this while taking off the dressing. But we're going to move on to the sterile part of this, and we're going to keep this as sterile as possible without breaking any of the sterile fields. And let's see, this is supposed to come with gloves, so that's great. I'm just going to move this down. That way we can show that I am not breaking sterile field. And in here is a little flap. You're going to pull that. And you're just going to want to touch the outer edge when you are draping Oh look, this actually has a mask in the kit, so this is where I put that mask on right here, and then under that is my sterile gloves, and these are mediums and I know they're not gonna fit me, so, and because I've already touched the outside of these, I don't want these anywhere near my sterile fill that I have here, so I could set this up away from that. That way the paper that is already touched my dirty hands is not touching my sterile field. And then we're going to go ahead and start the process of putting on sterile gloves and keeping that sterile technique. Like I said, these are mediums, so they really are not my size. My sterile fingers on one side, and I'm just barely touching the other side so I can pull that apart to put my hands in. So at this point, we are going to take the alcohol swabs and we are just going to clean in a circular motion, starting closest to the insertion site away from the site to scrub outwards in a circular motion. And once that is done, you're going to let that dry completely. And then we have the chlorhexidine scrub, and I'm not going to break this because, well, there actually is fluid in here. So it's a ChloraPrep one step, and it's more of a scrubby, so we're going to do the same thing, and we are going to start in the center, and for 30 seconds to a minute, once you pop this, you are going to scrub in a circular fashion from closest to the insertion site to the outward part. We are going to let that completely dry for up to a minute or more, and then we're going to discard that. And now my kit didn't come with a BioPad, which is that little jelly looking thing, but it did come with a sterile 2x2 that actually has a hole and a slit, so I could put this back around the tubing here. And I didn't take this stat lock off for a reason. I'm at work using the equipment. My boss allowed me to do this. So I'm just trying to keep the integrity of the equipment here, as they already have it. So I've placed that pad, and we are now going to place a Tegaderm over the site here. We're going to make sure that that is completely closed all the way around. That way we have done our part with keeping the risk for infection down. These dang stickers here. And then there's this little paper tape kind of thing around the outside edge. Once we know that this is been secured all the way down, all the way around, we are going to remove this. All right, so that is now in place. And I do have in my kit here, I do have a sticker here for date and time, my initials, and everything else. So I'm gonna fill that out and I'm gonna stick that on here. That way my other staff know that this has been performed on what date and time and everything. And at this point, I'm going to remove all of my PPE and everything to do the date and time. Now that my dressing change is complete, I can remove or doff all of my stuff, fill out my date and time for my catheter and place that on there, and I am going to get rid of all my trash and everything, and I'm going to chart on this patient. I'm going to chart the dressing change, the condition of the site, the complications, if there is anything applicable, and the patient's response to the procedure in the patient's chart, and we are now done.